was at his desk, right, or whatever.
Good, all right. Let me just get my...
Good to go from. Well, good afternoon, everyone. Welcome. It's good to have you here today to hear some updates from Grandview Hospital, now the Grandview campus of St. Luke's. I think all of you probably would be aware that as of July 1 of this year, Grandview Hospital, Grandview Health, is now part of the St. Luke's University Healthcare System. And that transaction officially took place on July 1. And so there has been a lot of work that's been happening prior to that and also after that to make that transition from Grandview to the Grandview campus of St. Luke's Health. Some of you may be aware that hospitals in the state of Pennsylvania and across the country face a lot of challenges, and it happens in our business too. Freestanding retirement communities are not as common as they once were, as consolidation takes place in our industry as well, although not at the same level as within hospital systems. So we are very privileged today to have Doug Hughes, who is the CEO of the Grandview campus of St. Luke's, here to give us updates as to what's happening within the Grandview system and the St. Luke's system. We're very privileged to have the CEO of that campus there. He had been the CEO previously when it was not affiliated with St. Luke's. And he also brought two colleagues with him, and he'll introduce them as well. What he'll plan to do is give some updates, talk about what's been happening at Grandview and what that means for you. And then there's also plenty of time for questions and answers as well. We did this yesterday at Doc Wood's campus and had a robust conversation as well. So will be plenty of opportunity for Q&A and getting updates on what's been happening. So Doug, I'll call you forward at this point and take it from here. Doug.
Thank you, Ed. Good afternoon, everyone. And as Ed mentioned yesterday, we were at Doc Wood's, but more of you showed up. So this is the bigger attendance crowd. And I know we're also online. So thank you for taking the time to come out and listen to our story. We want to give you an update on our campus, some of the things that we've done. We'll go over some other information, but the slides you'll see are really secondary. What we want to do is have time afterwards for you to ask any questions, because we know important to your life is our healthcare system, because many of you use our campus, many of you use our physicians. And this transition, I know, has caused some stress, and we want to make sure we answer those questions today so you're comfortable with what happens tomorrow in case you need to use our services. So we're going to get started. Who has visited the campus since we've added the building? Okay, so about half. As you know, about 3 years ago, we added a new pavilion to the hospital. It's about $200 million addition to the campus with the main goal of trying to expand our services. So the first thing you'll see is this is the same campus you had a month ago or 2 months ago or a year ago than you have tomorrow. The St. Luke's campus is the exact same Grandview campus, but we are proud now that we have up to 207 beds, and this added a big capacity to our building. And hopefully none of you have to use it, but if you do, it's there for you if you need it. As Ed said, my name is Doug Hughes. I'm also a nurse. I worked in the emergency room. I worked as a paramedic, as an EMT, many years through the emergency room, and now President and CEO of Grandview Health since September of 2021. And also with me today are Dr. Mike Prasto, stand up, and he'll be up for questions shortly. Dr. Mike Prasto is our head physician. If you've ever been to our emergency room, he's also an ER physician, so you might have seen him in the emergency room. If there's any questions about the bill, you can see him later. But he's our head physician. He was our head physician before we did the transition, and he's still the head physician now. Jill Laudenslager is our chief nursing officer, or head of nursing. She worked in the operating room, so if you were at the campus, you never saw her because she was behind the scenes. But she's been our chief nursing officer for several years. Again, stayed on after the transition. The goal for St. Luke's was to make sure that the same leadership team is there, that was there before, is there now. And one of the reasons we can hold on to our culture is making sure we have the same leadership team. He couldn't make it today, but Keith Hammerschmidt is a physical therapist by background, and he is our strategy person, so he's working on kind of what the next evolution of Grandview looks like. Unfortunately, he couldn't make it, but he is a lifelong Satterton kid. He grew up in Satterton, he was born at Grandview and has always worked here, so many of you may know him, or actually had therapy with him many years ago. So just an overview of who we are. We're a 207-bed hospital. We're also a level 2 trauma center. And I want to come back to that in a couple of minutes, but one of the reasons we knew we had a community that was getting older, many of our trauma patients are those who after falls, and I'm sure some of you experienced those. We see about 2,000 trauma patients per year now come to Grandview, and about half of those get admitted. And I'll go over some stats shortly. We have a maternity service. We deliver about 800 babies per year. And that was down a little bit, but we still deliver babies about 800 per year. We have a pediatrics unit with Children's Hospital of Philadelphia on our campus. And then we see in our emergency room about 31,000 patients per year go through our ER. In fact, I was there this morning and I saw one of your residents there and talked to them in the emergency room. Jill's in charge of over 300 nurses, but that's just at Grandview, and across the network now, as I introduce the network shortly, we have many thousands more, including physicians, has added many physicians to our network. As I mentioned, we're a trauma center. So the Pennsylvania designates trauma centers. There's only about 27 level 1 or level 2 trauma centers in the state. That means we have access to 24/7 care that's in the building. So we have an operating room ready to go. We have physicians in-house at all times. In case you fall or are injured, you'll come to Grandview and we have a full team ready to help you, which is not something we had many years ago. That's a bit of a change since 2021. Most of our patients actually are falls. So over the age of 55, almost 70% of the patients in our trauma center are from falls. After the age of 65, about 60% of those are falls. So one of the highest risk things we have are those who are older on blood thinners and fall. And as you know, that gets more and more difficult. And one of the reasons we have this program is to serve our community, which is, unfortunately, many of those patients who fall down. Yes, there are some younger boys who do dumb things, but there's not as many of those as there are falls that fill our hospital. And this is key for Grandview. There's a lot of pictures here, but the same community spirit we had at Grandview before we moved to a merger with St. Luke's, and I'll go over that in a minute, we have today. We play softball together. One of my favorite things is the golf cart. If you've been on the campus, we have a golf cart out front that picks patients up in the parking lot, brings them to the front door. In the old days, we had the building up on the hill, so you had to drive up the hill, so it made that a little bit easier. Now it's all flat. But we still have that, and we have many events across the campus. This is our maintenance team at bowling night. They were all dressed up. They won that year. But we still do those things because it's important to maintain the Grandview culture, what you're used to and what you expect when you come to our campus. So now I want to introduce St. Luke's a little bit. We'll go over some other slides and open it up for questions. But St. Luke's, as Ed had mentioned, across Pennsylvania, healthcare mergers have happened more and more. We were one of about a handful of independent healthcare systems left in the whole state, say 6 or 7. In this region, there were a couple. There was us, which we have now merged with St. Luke's, and there was Doylestown, which is now merged with Penn Medicine. As you know, Lehigh Valley and Jefferson, if you've paid attention to some of that, they've merged together as well. So Jefferson is now the largest healthcare organization probably in the state at about $16 billion, a very large organization that sees patients from Jersey all the way up to the Poconos. St. Luke's is about $5 billion, Mainline Health is also around, and Penn Medicine, of course, at about $12 billion. So we're all, unfortunately, getting into bigger organizations because it's very hard to compete as an independent healthcare system in this state, let alone the country. So we had a decision to make, and unfortunately, to make sure we continue to give the positive, great care that we give to all of our community, we had to merge with a bigger system, and that is something many of us have done in the state. So we reached out to St. Luke's. One of the focuses for St. Luke's is they're not an academic medical center, so that means like Penn Medicine and Jefferson have colleges, and they do a lot of education and research, and the community hospitals are after that. St. Luke's is all focused on community medicine, and I'll go over them now. This is their vision, which is to be the highest quality healthcare system in the region. And I know some of this might be new to you because you might not have heard the St. Luke's name before, but Penn Foundation across the street from Grandview Health became part of the St. Luke's network around COVID. But they have a lot of the similar initiatives that we do, which is make sure we deliver high quality healthcare to our community. This is a very busy slide, but it shows the entire St. Luke's Health network. One of the first hospitals they purchased was in Quakertown Hospital, I think in 1995. And now there are 16 hospitals, including Grandview, which is way down here at the bottom, but they really expand up north. So they have patients all the way up into the Poconos as well, and also into New Jersey. Just for size, we had 2,200 employees at Grandview. And now part of the network, we have 22,000 employees across the network, which is much bigger. Not as big as some, but certainly much larger. With that comes outpatient facilities, urgent care centers, and all the other sites of service that any healthcare system provides. These are some of the focuses of the network. So this is outreach at the Upper Bucks campus, which is now one of our sister facilities. They have senior meals there. They have some other volunteer activities. So as we get more and more involved in the St. Luke's Healthcare Network, we'll be bringing those services down to our region as well. I think many of you sit here and you think about quality. You want to make sure the hospital you go to is high quality. Jefferson, Penn, they're big names. And I highlighted several of these at the bottom. But when you compare St. Luke's quality, so the care that you're being delivered, is it good or bad, when they rank different ways, St. Luke's comes out on top for high quality health care. It's an A grade, just like Grandview was, on an A through F scale. They're an A grade by Leapfrog. And then the government Medicare rates healthcare systems as well, 1 star through 5 stars. And St. Luke's is a 5-star healthcare system. I don't expect you to memorize any of this, but I think if I'm sitting out there, I want to make sure if I go to Grandview, it's going to give me high quality healthcare. And this is just to reassure you that we get rated by many, many organizations. There's a whole list of them here. And all of those make sure we're doing a good job to deliver care to you. And every one of those is certified, both Grandview and also St. Luke's. Are there any nurses in here from nursing schools? All right, so a lot. Anybody go to St. Luke's? Look at you. So they are, St. Luke's Nursing School is the oldest nursing school in the country. So many organizations had nursing schools just like Grandview. Any Grandview nurses that went there? Okay, so well, there we go. So many of you, we had a nursing school at Grandview, closed in 1973, I think was the last class. St. Luke's kept theirs open. It's one of the oldest programs in the country, which is still active. They also have a medical school, so you can go to medical school. If anybody's interested, see Dr. Prasto. If you want to go to medical school, you can, but you can do that right in the Lehigh Valley through Temple. So you never have to leave the Lehigh Valley, including residency. And then all the other schools they've partnered with to make sure they're growing employees. One of the biggest challenges we've had over the last several years is getting staff, whether it's nurses or physicians or respiratory therapists or EKG technicians. So rather than, we didn't have the size to be able to kind of grow those programs, but St. Luke's does, and they've been doing that for many years. So they've invested many programs here to make sure that they can have students coming out for their employees. And one of the main reasons we're here, and this is kind of where we turned it over to more of a question session, and Ed asked me, how is this going to impact you? What is the difference from Grandview today than it was a year ago? All of the physicians at Grandview are now part of the St. Luke's Healthcare Network. So you might see different bills coming through, but most of those, and there's a couple that did not, have been absorbed and are now part of the network. So when you see a physician, instead of seeing a Grandview Health physician, you might see the exact same physician, but they're going to be a St. Luke's physician. Does that make sense? So if you have a primary care physician and they rotate through and they're part of the Grandview network, they're still going to be there, but just under a new name called St. Luke's. The bills might be a little different. We still take all the same insurances, but those bills will be coming from St. Luke's in the future. Probably the biggest thing that has changed that will affect you is we left our computer system called Meditech and moved to something called Epic. If you have a record inside of Grandview, you should have got the text message about MyChart. Did everybody get that? Okay. We set a couple up yesterday, but I know that's still a challenge because that app, if you use your phone, really generates all the new records that you're going to access. But we still have access to the old Meditech, so if you go see your physician, we have folks that are bringing information over, so your doctor's ready to see you with the new records. But that is one of the big changes, and we now have access to MyChart, and I think the staff here have access to it, or if your families do some of your healthcare research for you, they can sign you up for MyChart as well. But that's an app on your phone. We are the exact same hospital today that we were a year ago, which is a level 2 trauma center. As I introduced Grandview, still with births, seeing the same patients. Our emergency room is just as busy today as it was a year ago, maybe a little bit busier. But we continue to provide the same services we did, and that hasn't changed. But now we have the resources of the network. And one of the reasons that's important is if there's a disaster or if a physician leaves or if Jill needs more nurses, they can now come down from the network to help us. Whereas a standalone organization, we didn't really have that access. So that's been a change. And then all of our outpatient centers are going to remain the same. So if you leave here and you go to one of the campuses, it's going to be the exact same campus. We're going to update the signage soon. But we haven't done that yet. But everything we do from an outpatient process today will be the same. There might be some tweaks as we work inside the network over the next couple of years, but in general, it's going to look and feel the same to you as it did before the merger. And then this is the app, if you get it. If you have any questions about that, one of the things we're going to ask is that if we need more access or more help for you guys, we can figure that out. But I know that that's a big struggle, getting onto Epic to make sure you understand where your records are coming from. So with that, I'm going to ask Jill and Dr. Prasso to come up. I really want this to be an open session for you to answer or ask us questions. And if Jill or Mike want to add anything, or if there's any questions, things I forgot, feel free to fire some questions at us. Somebody has to have questions.
I'd like to ask a question.
Okay.
I fell and hurt my ankle, and I don't like the word is face. It's saying.
Okay.
And I went to Grandview Hospital, and those people at Grandview Hospital are so nice.
Why, thank you. I'll assume it's the doctors and the nurses, not the administrators, but I'm glad we took good care of you.
And that's not going to change.
That's right. Yes.
We've been seeing Dr. Oliver and Travis since we moved into this area. If I'm incorrect in what I'm going to say, please correct me. My understanding is we still continue to see those folks, those doctors, and we require surgery. They cannot operate on us at Grandview facility. Am I correct?
That is correct, and I'll let Dr. Prasto answer some questions, but you asked the hardest question right up front.
Well, that's concerning, because we both have
Yes.
our issues.
Yeah, so one of the biggest changes is our cardiology program, because what's called Alder for Travis Cardiology, or ATC Cardiology, is not part of Grandview any longer, which has caused some stress. And on top of that, that particular group broke in half. So half the doctors went to Jefferson, half the doctors went to Doylestown, and then we want to retain as many patients as we can at Grandview. But the most important thing we've been trying to impress, and I'll come back to your question a bit, is when there's an emergency, we need to get you to the closest hospital. And then we'll worry about all of that later. As an outpatient, if you want to see any cardiologist, you can, which I realize we've caused some confusion because we're not sure if you have appointments or not appointments. We want to make sure anybody who needs an appointment with cardiology at Grandview, if you were part of the BCA group, if you remember that name, Dr. Hermany, you know, that group still exists and is getting larger. We're adding physicians to it. We'll make sure you have a cardiology appointment at Grandview. We didn't do surgery before at Grandview for cardiac surgery, and we won't do it probably in the future. But we still have all the same cardiology services at Grandview, just without Dr. Alderfer. Mike, if I missed anything?
I think that's it. One of the biggest things, and I want to emphasize for people, is that during this whole transition, or really when we started looking for a partner, was patient access and quality. And those were really, really hard discussions that we had with future partners that, you know, Doug, me, Jill, the whole team at Grandview, all the physicians really built a high quality program at Grandview. And we need to make sure that our partner was able to support us. Because from the physician side, that was my hardest thing, was to get physicians and nurse practitioners and PAs to hire them, because we're growing at a pace that we need more and more physicians, and it was very difficult. And the one partner that really had a plan for us, and we talked in lots of dinners and met with lots of partners, was St. Luke's. And they had a specific plan to get access for all you, meaning that they want to be in the top 10% in the country for patient access, meaning you call, you can get an appointment. There's going to be roadblocks on that, but we definitely had an issue previously. That was one of the biggest complaints we had, was getting patients access. And they are, in a good way, just like we are, obsessed with quality. They're really one of the highest performing institutions, networks in the country. And we're not making it up. There's really only 2 ranking systems for this in the country, and they're in the top 100 every year, and their hospital actually won, the St. Luke Anderson campus won best hospital in the country 3 years ago. So that's why we did these things, and really to make sure that we have access for all of you.
And your question about, did we answer your question about cardiology?
You said something like you do not do cardiac surgery there?
Correct. We never have. So if you, let's just, if you come in with chest pain and you need a cardiac catheterization, not surgery, but a catheterization, we do that. So in an emergency, we provide the emergency service that you need to make sure you're safe. And we get that on a regular basis, and that still goes on today like it did yesterday without the group that you're talking about. Cardiac surgery is different because we've always sent those patients somewhere else, whether it's Doylestown or whether it's Penn, whether it's St. Luke's or Lehigh Valley, because many of you may have histories with cardiologists or other surgeries, and sometimes you go back to where you started, and sometimes you don't need that. But that cardiology is, we have all of the advanced services we need to make sure as an emergency you're safe. When you need to be transferred for a higher level, which is cardiac surgery, we do that somewhere else. Now we do as part of the trauma program, we do brain surgery in every other part of the body, but we've just not done cardiac surgery. But the main message I want to leave is for you on the cardiology is, first thing is get to a hospital if you have a cardiac emergency, and let us figure that out. Mike and Jill can work with their clinical teams to get you wherever you need to be. What we don't want is folks trying to get over to Doylestown or down to Jefferson or somewhere else when you're having an emergency, because that doesn't help. And then, as Mike talked about, one of the complaints we got yesterday, this might bring in more questions, is some of our call systems. So when you call for appointments now, it might be a little different than it was before. We are working through that because we have one call center for the whole network. When you get that app on your phone, you'll be able to schedule appointments that way without having to call anybody. But that's a process yet that we're working through. How'd I do? Yeah, okay. I didn't tell you, my mother's listening. She's at the Willows, and she's listening right now, so you have to give me a better grade than that.
You're saying what you're saying, it's just,
It is,
bigger is always better, but I guess that's the way it has to be. I'm sorry.
it is difficult, there's no doubt. Becoming an independent hospital to a network is hard. And then the cardiology issue, which many of you have been ATC patients for a very long time. And I realize, Mike realizes, Jill realizes, that's a problem. And we want to make sure that we provide you, whatever that cardiac issue is, we have doctors that can do it, or we'll get you to the doctors that you need to.
When you said there's a central place to make appointments, does that include outpatient x-ray and blood work?
The question was, is there a central place to call for appointments that includes everything? Yes. Doctors, blood work, x-rays, EKGs, all that.
How do we get that number?
That is a great question, and we have it.
Thank you.
Well, before we leave here, we'll announce it in case they can listen to it online. Yep.
About a month ago, I had a text message saying that I had a test result, which I never went for one. Here it was somebody else's test result in my portal. I had called the center, and I wanted to, put it through my family doctor, saying that this is not me. I never got it taken care of. It's still there.
We can touch base afterwards, and I'll fix it for you. There were, about a month ago is when we transitioned. So-
I didn't have it.
Yeah, so the question was that she had some blood work that was not hers or test result in her portal. About a month ago, we had the transition. There were a couple off patients that, when we are trying to backfill things, lots of this is by hand, that we may be pre-populating things, and we'll work through it, but I'll get your name afterwards, and I'll look into it, and I'll get a ticket set up, and we'll fix it for you.
You said you do brain surgery. Is there a chance that you will be doing cardiac surgery in the future?
So, unknown, it's a good question. So the question is, we don't do currently, in cardiac surgery, what you're talking about is valve replacement and open heart or CABG surgery is what I assume you're referring to. We have never done that at Grandview. St. Luke's is one of the highest ranked in the region actually doing it. It doesn't mean that we won't do it at Grandview Health. Quite honestly, what we're trying to do, build here, I mean, Grandview, I'm sure you guys have realized in the past 10 years has grown exponentially in the services that we provide. So it doesn't mean that it's not possible. And some of the things that we do want to do might require us to have that service, but it's not off the table, but there's no set plan for it just yet. You're welcome. There's got to be more questions.
How about a hard nursing question?
Well, she said it all. They were great.
Yeah.
Our goal for coming out today, you have another question?
Yeah, real quick. Are the phone numbers still the same, like central scheduling and everything?
No, you want to look that up and we'll announce it. We'll get you, I'm going to announce it just in a second, the phone number. So if anybody has a pen or a piece of paper, we can give you that number, but.
All right, so there, as we talked about, there's one number to call, whether you're looking for blood work, to schedule a radiology test, to schedule a physician appointment through the St. Luke's Network, and it's all through the Patient Access Center. And that phone number is 484-526-1128. 484-526-1128. Yep. 484-526-1128. Everybody got it?
That replaces the old central schedule.
Correct. Yep. Everybody got it? I could say it again. One more time, sure. 484-526-1128. I've actually called it once, and somebody picks up pretty quickly. Yeah.
So one of the things is we track these times, and our times, I don't want to say were terrible previously. They were, and it's I mean, most of the time before they finish, like, hey, this is St. Luke's Health Network, they pick up the phone. I mean, when my mom has been calling for my father, she's actually called me and told me how much better it is. So that was one of the things that we couldn't do previously, not being part of the network. We knew it was an issue, and we needed to address it, but we did not have it was not just sustainable for us to do that, like financially and manpower-wise. And now we have the resources of the network to do things like this. Doesn't mean there's no issues with the Patient Access Center. It's addressed lots of our access issues that we've had, but there are still issues that we need to work through.
Yep.
We have a nurse coming in for blood work here. Does that still apply?
The question is, we had a nurse coming in for blood work. Does that still apply? I think you have a new system for blood now, right?
Yeah, that's not going to change.
The current, whatever the setup right now is for blood will stay the same. There we go. Make it a zinger.
So what you're saying, if our doctors have a quarter blood work for us, and we get the papers and I go up to get it done, I never have an appointment, do I need an appointment now to do that? Or can I walk in, at least walk at the Grandview outpatient?
I think it's the same as, the question is blood work need an appointment? I believe you can walk in for blood work at any time, just like you did before. Yep. That hasn't changed. Usually the scheduled appointments are more for radiology tests, x-rays, CAT scans, MRIs, and some of the, obviously, physician appointments. But blood work's been pretty much a walk-in visit. Yep. Well, I want to thank you for taking the time to listen to us. One of the goals we had by coming out is this is the leadership team of Grandview Hospital. It was before and it still is. You know, our focus is making sure we deliver great health care to this community. That has not changed with St. Luke's. The building that I started out with, which we built a couple of years ago, is still the exact same building it was. It might have a name of a sign change a little bit at some point. It hasn't actually changed yet, but it's the same staff. It's the same organization, and it's really just focused on making sure we deliver great care to you, our community. So if there's things that we have not done well at, you know, our goal is to make sure we get through Ed and the staff here. They can facilitate that information to us. We'll try to fix it. We kind of pride ourselves to being local and accessible, and if there's anything you need from us, you just let us know. So thanks for taking the time to come out today, and if there's any questions, we'll be around for a little bit afterwards. And I did leave some pens and cups and stuff in the back if you want any of that. So have a great day.